Hey everybody, before I get the video started, I just wanted to thank everyone for coming to my channel and checking me out. Like I said before, I have a lot that I need to change on it. Just be patient with me, but for anyone that's looking for a post-op operation surgery on the spinal cord, please continue to watch. And I will see you guys on the next one. Feel free to hit that like button, subscribe to my channel if you're not subscribed, and I'll see you guys next week. I had my surgery done Friday, which was May 15th? I know I'm lying. What's today, the 20th? So, let's see. Yeah, the 15th. Alright. So that means the drugs is not getting to me. That's a good thing. So yeah, I had my surgery, and the surgery itself, went well, from my understanding. With everything going on out there, for anybody that's looking to be getting any kind of surgery with the epidemic that's out there, what I would tell you is that you will be okay, and just take a deep breath, and in that time, in that moment, in that week, just be in deep thought of being calm. I'm going to tell you a little bit about my day, that day. So, I get there to the center, and I've been suffering with my back for, let's see, I've been suffering since June of 2000 and, no, I could be lying, August of 2019. And, like I said, I've been suffering since then. I hurt my back on the job, and I just been out of work because of that. Because of that, went through physical therapy. I went through seeing a chiropractor. I did the spinal injections, and it just didn't work for me. So, before I had my surgery done, about a week before I had it done, I went to go see my surgeon, and I don't know if I had my hearing aids turned up that day or what, but I quite didn't hear him say that the surgery was going to be on the 15th. So that was my mistake. So yeah, like I said, I get there, I had my sister there with me. So, that wasn't an issue. It was just mentally, I was not prepared. And, the nurses, looking at me like, oh, you didn't know that you was having surgeries? Because when you come in, they ask you, okay, can you tell me what's going to happen today? I'm like, yeah, spinal injection. From my understanding, with me and my doctor's last conversation, that's what I thought we talked about. One more spinal injection, which, I was pushing that, hey, it didn't work, so why do it one more time? But I'm just like so over it, the pain and everything else, and, just eager to just go back to what I was doing. I gained a lot of weight because of this, and like I said, I just wanted to start my life and start going into a different direction. So, yeah. In that time frame, I really didn't have much time to, grasp much thoughts, but, I did, and I got myself together, and mentally, I was A-okay. I know I was in good hands. My doctor, my surgeon, he is A1, and I've heard many great things about him. prior to me actually walking into his office. So I know I was okay with that. It was just myself just mixing up some things in my brain. But yeah, so yeah, I had the surgery, and I stayed with my brother and my sister for a few days after I had the surgery. And then I came home because, you know, as a mom, as a parent, I'm a single parent on top of that. And just, we are just a tidbit OCD. I give that to our single parents out there, including myself. We are just a tidbit OCD, and we just try to grasp everything around us and just try to, you know, dot our I's and cross our T's all the time. And regardless on, even if a doctor says, hey, calm down, you know, relax, it's still in us to just do that. So that's just what I've been doing since I've been home. Of course, yeah, resting, because pain knocks you down. And the pain after the surgery, like I said, I just had it done Friday, and today is the 20th, so the 15th, 20th, not even a week yet, you know. But one good thing is that my stitchers are itching, so there's some healing going on, and I can't freaking scratch it, but that's okay. Pain. Okay, so I found it. Well, I didn't find it, but my baby gave me the spray bottle because she actually took out her sister's hair. So yeah, what you're gonna feel is a lot of pain. I don't feel the pain that I was in before surgery, and I had a lot of stabbing pain shooting down my left leg. I have a herniated disc, which is L5 and S1. So that's what I've been experiencing for months now. Anybody that's going through a you know, trying to get the help that you need out there, always believe in second opinions. My surgeon that actually did the operation, he was my second opinion. You learn a lot of that when you're in school. I actually finished my vocational school, which is billing. I went to school for billing and coding. Kind of sucks because everything's closed, and I'm waiting to start my externship. So, but you learn a lot of that in school. So yeah, he was my second opinion, and as soon as we did the second MRI, it clearly showed, you know, not saying that, okay, the first MRI wasn't enough, but pretty much, yeah, I needed surgery. So no, I don't feel that stabbing pain that I was feeling before I had the surgery. That I don't feel. But because of the surgery, and I'm going to say because of the surgery, because I don't want, you know, I don't want this to be an ongoing process of, you know, hey, you need the surgery, you need another surgery, or, you know, I really don't want that. But at the same time, I mean, I'm 30 years old, and I want to be able to get out there, ride my bike with my kids, want to go camping, you know, be able to walk a few trails with them. I'm all over the place with this hair, guys. But I want to show you, and also show myself, really, because this is my first time doing this. This is not a sponsor video whatsoever, so don't worry about any of that. Anything that I'm using, I actually bought off of Amazon at a reasonable price. So what I'm putting in my hair right now is Leave-In Conditioner by Giovanni. And I've been using this thing for years, to be honest. Literally for years, okay? So, I pretty much just rub that thing in. I really rub this thing in. I may need to get my daughter to pick this thing up, because after you have surgery for a good 4 weeks, there's no bending, lifting, or twisting. So I have a detangling brush right here on the floor that I can't even get. And I don't have a grabber, a reacher, whatever you want to call those things. So I can't get it. But let's talk about pain. So the pain that I do feel is a muscle pain. So, you know, L5-S1, that's basically the cocox of your spinal, which is your tailbone, okay? So yeah, standing up straight. It's a lot of pressure, guys. So if you see me doing this, you know, it just feels a little bit better. Hopefully I don't have to sit down in the mix of this video, because I really just wanted to make a brief video. I'm trying to think, what else do I want to put on my hair? When moisturizing your hair is not all the way moisturized until you seal it with oil. Your hair is never moisturized if you put oil on your hair. Now I got this. So, I don't know what my child been putting in her hair and detangling it. It's all in this detangling brush. Okay, so we talked about pain, and that's pretty much that pain. I feel a lot of pain, like I said, on my butt, my body and whatnot, on my hips. Like I said, I really hope that I don't become, I'm not that person that, gonna have that permanent pain. So, yes, throughout the night, I talk to my time, eating with my meds, you know. So, I'm going to detangle my hair. I did not make that noise because it hurts my head. I made that noise because of my back, guys. So, this is a workman's comp case. I'm not sure if anybody out there is going through working this comp case or whatever. But be proactive if you are having surgery, because I was not proactive. I was not proactive at all. And I ended up buying one of the neck pillows, you know, the traveling pillows that you see people use on an airplane. Well, I ended up buying one of those, and so far so good. I like it. Ouch, like really? I need to wash my hair, to be honest, but that won't be happening. I hope that this video gives you guys, you know, a little bit of insight on spinal surgery. Like I said, it hasn't even been a week. So, if you guys would like to see more videos on my progress, my healing progress, then hit that like button. Subscribe to my channel if you have not. I know I have a lot of things that I need to change within my channel. It's just been really hectic. Like, not life itself, but like busy life. But YouTube was something that I enjoyed at one time in my life, and I would like to find that enjoyment again. So one day, this is another piece that I'm going to use. This is the glove, and with the glove also came the sponge. I bought this off of Amazon, like I said. It's a two-sided sponge, and then you have the glove. So I'm not really familiar with these kind of stuff. Me personally, I like the messy look, and that's why I bought it. Me and my daughter, my oldest daughter, actually have the short haircuts. I'll tell you one thing, the pain medicine seems to give you some kind of side effects. I won't speak for mine. I'll just be sweating up a storm. Alright, so it's probably looking crazy. It is what it is. Ooh. That's what messy hair is supposed to do. Look crazy. And yeah, it's making me sweat. Like, I don't know what to call it. I'm not going to use this. Oops. What I am going to use is my handy dandy edge brush. I just lay my edges down. So, anybody have any other questions when it comes to spine surgery? Please leave them down below so that I can answer them. And again, I hope you guys enjoyed this video. I enjoyed it. I get to try out my new sponge. My glove. Not so much my sponge, but my glove. Okay. Alright. How does it look? I dyed my hair. I love my color. I have no earrings on. I'm freaking sweating. I don't even sweat, guys. I don't get me wrong. I sweat, okay? But I don't be doing all that shit. I just don't. So, this is running. Put some vitamin E oil on my skin. Can y'all tell I haven't had my eyebrows done since the shutdown? I mean, I'm looking just a tidbit bushy, okay? And I know I'm not going to touch it. I'm just going to be patient. Hopefully my sister come down. I told her to bring her behind out here and take care of me.